Hello friends, and today I am back with another topic, and this topic also is very common, but I am surprised that many people remain undiagnosed for several years and they continue to suffer in silence, and that condition is called as restless leg syndrome, and in short it is called RLS. So far you have heard that the one can be restless in the mind, or but what is this restless leg syndrome? Can the leg become also restless? The answer is yes. So what are the main symptoms which can happen in a person with restless leg syndrome? So in that, as the name suggests, the person has some kind of discomfort in the legs, and the discomfort can be pain, it can be cramps, tingling, so various kinds of unpleasant sensations, and this occurs when the person is resting. And when is the time when persons are resting? That is during sleep time. So this typically occurs when the people go to bed and they try to sleep, and then these kind of abnormal sensations come, and to relieve the symptoms, the persons, they need to move the legs. So some people, they keep jerking the legs, some people need to get down from the bed, and then they need to walk a little bit, and as soon as so when they walk and when they move, the pain and discomfort reduces. So again they try to sleep, but again after some time same symptoms come. So what will happen? Because of this, the night sleep is disturbed, they can't sleep properly, and as a result in the daytime they are fatigued. So you'll be surprised that this is not a rare condition. This affects almost 5 to 15% of our population. That's a huge number. But the diagnosis is rare. It's not properly diagnosed because the awareness about this restless leg syndrome, it is less among public and also among the doctors. And as a result, the people, they continue to suffer. But there is no need to suffer because there are excellent treatments for this. And even if you look at this condition, the diagnosis is based on the symptoms. So what are the main symptoms? Just to summarize, so the persons, they will have restlessness or the discomfort in the legs, typically occurs when they go to sleep, and also when they are on the long drive. So because when you are driving for a long time, again you are resting. At the rest time, again the similar discomfort starts in the legs and they want to move the legs. So whenever there is a prolonged period of rest of the legs, these symptoms occur, and the persons have an urge to move the legs, shake the legs, and then the discomfort reduces or disappears. So there are two main features. And also we need to rule out certain other conditions which can cause this restless leg syndrome. In that, the number one is iron deficiency. So those who have iron deficiency, they have a higher risk of getting restless leg syndrome. By a simple blood test we can diagnose that. The second one is pregnancy. Of course, pregnancy is not a disease, but almost 1/3 of pregnant women, they can have these symptoms. If they have these symptoms, we can treat them so that they can have this comfortable duration of pregnancy. And the third condition where this restless leg syndrome is common is chronic kidney disease. Especially those who are on hemodialysis, they have this condition as much more than others. And of course, we also need to check other deficiencies like vitamin B12 or calcium deficiency, vitamin D deficiency. So those deficiencies also can increase the risk of restless leg syndrome. Now when a person has come to us and we suspect restless leg syndrome and we have ruled out other conditions, then how do we treat? So the treatment is based on medications. So there are excellent medications to treat them. Here I can't discuss in detail about the medications. Once you consult your doctor, depending on your symptoms and the severity, they'll be able to start medications, and the patients have excellent response. I've had patients who have continued to suffer for 10 years or more because few doctors told them there is nothing which can be done. They have even been referred to psychiatrists. They said you are imagining something, there is no disease like that. But then when we start medications, within first few days itself, they get so much relief and they sleep peacefully and they're able to focus on their daily life and the work much better. So in conclusion, what I would like to say is that this restless leg syndrome is a common condition. It is not your imagination. Those who are suffering, it's a real disease which is well known, well described, and there are good treatments for this condition also. And just to add a note, even though it is restless leg syndrome, some people can have similar symptoms in the hands also. So even though it's not called restless arm syndrome, even though some reports are described, but the basic features are similar to restless leg syndrome. So that also can be treated in the same manner. And so if you have these features where there is pain or discomfort or tingling in the legs while you are resting, that is during sleep time or during long drives, consult a neurologist, get properly diagnosed, get treated by simple medications, and then you can lead a comfortable and healthy life. I hope you enjoyed this video and learned something. Thank you.